Hi and welcome back. This is Georgiana again, and today we're going to be covering part 2 of our workshop on how to use GIS to enhance contact tracing efforts. So today we are going to get our hands-on experience using a GIS program. We're going to use an online tool called ArcGIS Online, which is created by Esri, which is the industry leader in GIS. So today we are going to upload and analyze contact tracing data, not real data, of course, those same fake cases that you've been using for this data portion of this. So as a reminder, what do we need for a GIS analysis? We need a spreadsheet that has some sort of geographic identifier, maybe a city or a zip code or a census tract, or if we have addresses, even better. The more nuanced, the better. We can get more nuanced information. And the second thing is the spatial data. Now with ArcGIS Online, oftentimes if we have addresses, for example, ArcGIS Online will be able to geocode, what's called geocode, those addresses without you having to upload the shape file, which is a great benefit of the program because, again, there's a less steep learning curve for this program than for some other desktop GIS programs. So I want to talk about 3 key pieces of information that we will go over briefly as we're going through ArcGIS Online, but they're helpful to set the stage. The first is projections and coordinate systems. You could spend actually an entire semester or quarter, as you all are on quarters over there, on just projections and coordinate systems. Those are the units in which spatial data are collected and how a 3-dimensional Earth is displayed on a 2D surface. They're very complex and affect GIS analysis, but the great thing about ArcGIS Online, and I promise they're not paying me to say this, but it handles projections and coordinate systems in the background for you. So it's one less thing that you need to learn before being able to get started with your GIS analysis. The second thing that I want you to keep in mind is how to choose a map type. And we'll talk about this when we get into the visualizing the data portion, but it's helpful to keep this in the back of your mind as you're looking at count data. That is, for example, the number of cases. You would want to use what's called a graduated symbol. So maybe circles of varying sizes, as you see here in this example. If you're looking at rates, however, so maybe cases per 10,000 population, then you could use what's called a choropleth map or a graduated color map. And you might often see, for example, in popular media, sometimes you see counts shown as a choropleth map. And that's one of the cardinal rules of GIS is counts are shown as graduated symbols, rates can be shown as graduated colors. And the third thing is we are going to add contextual data, but we're going to do it within ArcGIS Online. So again, another great thing about this platform is that you don't have to go and download all of these individual tables from, say, the census or the California Department of Public Health or the County Department of Public Health. So much data is already available through ArcGIS Online platform. Part of it is called the Living Atlas. And you can upload that data and sometimes use it very quickly within the program without having to upload every single piece of geographic information on your own. So that's helpful to keep in mind as we move forward. So what are we doing today? We're going to step through this step by step together, doing several things. We're going to start by preparing our spreadsheet for uploading. It has to be formatted in a certain way and only certain file types are accepted. So we're going to talk about how to prepare the spreadsheet. Then we'll upload it to ArcGIS Online in order to geocode, what's called geocode it. So place the points for the cases and the contacts where their addresses are. We'll then visualize that data. So we'll look at different ways to show those cases and contacts. And then we'll add some contextual data. As we mentioned, one of the strengths of GIS analysis is being able to pull data on so many different attributes. And so we're going to add some of these contextual elements using data from ArcGIS Online and then conduct analysis to identify perhaps some target areas that we might concentrate contact tracing efforts on. All right, so before we start, make sure that you can log in to arcgis.com. So you can go to arcgis.com and you should have already been added to the UCI organizational account on arcgis.com. So you can log in through the institutional login. Use your UCI email address and log in through your institutional login to get access to that. And you can have that open while we go through the cleaning process of the table. And I'm going to post these table requirements here, and I'll talk you through them as we are cleaning the spreadsheet. But you might want to take a look here and take a couple of notes. We'll make sure that our file is in CSV format when we're done with it. It has to have a geographic identifier, as we talked about, so maybe the name of a country or a state, or in our case, we're going to have street addresses. But there has to be some sort of geographic identifier, or else you're not doing a geographic analysis, right? And then you want the first row to be the header, and the second row should go immediately into data. So no sort of subheaders in the second row. Okay, folks, so welcome back. Let's get started with ArcGIS Online. We'll go ahead and open up your web browser and go to arcgis.com. And you can click on the sign in button. And you should see here your ArcGIS organization's URL, and you should have perhaps UC Irvine here. So you might type in something like ucirvine.maps.arcgis.com, or maybe it's uci.maps.arcgis.com. So mine is Chapman. And I'll click continue, and then it gives you a single sign-on, which you should be able to use now that you have been added as part of the ArcGIS Online organization through UC Irvine. So that should have been set up for you, and you can let us know if you have problems logging in. And if you do at this point, pause and email someone, and then we will figure out how to get you access. If you've made it past the login portion, we're going to just leave arcgis.com open, and we're going to begin by preparing our spreadsheets. So go to wherever you have your spreadsheets downloaded, and you should have already worked with this Excel worksheet called Fake Cases VE_VE2, and we're going to use a second one that you're also downloading called Activity. So these are the two worksheets that we currently have. Again, this one should look familiar. You've probably already used it. And it has two tabs or two sheets within it, cases and contacts. And activity has just one sheet. And these are very limited activities for some of the cases. So these are all case activities that can be linked to some of the cases in this spreadsheet. Okay, so we are going to create CSV files out of these. Now, there are multiple ways to use arcgis.com. It is possible to upload an Excel spreadsheet directly into a different part of arcgis.com, but we are going to use CSV files. They tend to be a little less glitchy. And so what we want to do is copy and paste the data for each of these sheets. And we can copy and paste it into just a brand new, so go to File, Blank Workbook. And you can use Control-V to paste easily. And we're just going to save each of these, save as. And we can browse wherever we want to save it. I'm going to save it in the same folder where I have the other one, the other files. And make sure that you change the type from Excel workbook to just .csv. Now you'll notice up here there are other CSV types. Just use .csv, comma delimited with nothing else. So it's about halfway down. So we're going to use comma delimited .csv file. We can call this, since we copied over cases spreadsheet, we'll call this cases. And it's best practice to not have spaces in either the file name or in the headers. We can close out of that one and do the same now with our contacts. We're going to copy all of the contacts. This is a long file. And you can use Control-C to copy. We'll go up to File and create a blank workbook again. And if you click and use Control-V to paste, we now have our second file that we can save as a CSV. So we're again going to save as. I'm saving it in that same folder that I have the other ones in, making sure that I choose .csv. And this one we'll call contacts, since this is the contacts file. And we can save that. Okay, one more to go. We'll close out of fake cases and now move on to activity and make sure to save. Actually, this one we don't even need to copy and paste. It's just one spreadsheet. So we can go to File, Save As, CSV, and we'll save activity.csv in this same folder with cases and contacts CSV. Okay, so now we should have these 3 CSV files in the same folder where we had the original files. All right, so now we know where those are saved. We're going to go back and navigate into arcgis.com where we logged in. And you'll notice several tabs up at the top. This content area is where you'll see all of the files that you upload and the maps, web maps that you create, perhaps shape files if you've uploaded those. You remember from the previous video that shape files are a spatial file, and we don't always need them. In this tutorial, we're not going to upload our own shape files. And then you can see some web maps and what are called feature layers that are created out of the tables that we're uploading. Okay, so now we can upload our item to the content area, or 3 items rather. So we'll go up to Add Item from your computer, and notice it says you can publish a layer from a file, upload a document or image. So we're going to publish a layer from the file. So let's find the CSV file. Here we have activity, so we'll start with that one. And we want to title it something that is intuitive. Oh, it looks like I misspelled activity in the file name. So we'll title it activity, and we can give it a tag so that we can easily find it. I'll use COVID-19. If we have multiple layers, you can use tags to search them. We want to make sure that this file as a hosted layer is checked, and that will give us some capabilities that we wouldn't otherwise have if it's not a hosted layer. And you should have permissions and should see this option here. If you don't, it means that you weren't given the correct permissions through UCI organization, and you may not be able to perform some of the same analyses. So if that's the case, again, let us know. But make sure that checkbox is checked. And then it's asking, do you have addresses or latitude, longitude, or do you want to just add as a table? And we want to make sure addresses or places is checked, and location only are the output fields. And then we have to tell it which are the location fields that we want to use to what's called geocode the addresses. So we want to place a point at the correct address. So we have 2 fields, one that contains the street number and name, and one that contains the zip code field. So we'll select zip for the activity zip field and address or place for the activity address field. And then we can add item. And we're going to repeat this process for both of the other CSVs. The fields are almost exactly the same, except you might recall that in the contact and the cases, the address fields are called contact address or case address, right? So try to do that on your own and see if you are able to do it. And if not, you can follow along with me. So here it tells you how the geocoding process went, and you can see that all 13 locations were matched, and it asks, do you want to review it just in case? Sometimes we might get a point somewhere else in the US if the geocoding process went awry. So it's always good practice to verify your matched addresses, and it does zoom in to where your cases are geocoded to. And so luckily we can see that all of them are geocoded here in Orange County, which means that we have correctly geocoded. And if we have numerous, we might sort of at random check that these indeed are geocoded where these addresses are. We might use, say, Google Maps, or we might zoom in to each point and just verify, for example, that this point is at 6611 McFadden. So we might sort of gut check by zooming in and making sure, okay, yes, this is McFadden Avenue. And we might zoom in far enough so that we get a sense of the actual address, 6599. Okay, so this is probably a correctly placed point at 6611 McFadden at this zip code. All right, so once we're done reviewing, we can click Done Reviewing. And a quick way to go to the full extent is to click this little Home button. And you'll notice if you hover over Activity, it brings up multiple options here. So here we can show the legend, and currently the legend is just a red dot for each point at their address. There's no attribute being shown. We can show the attribute table. This will show us just the spreadsheet that we saw earlier, and you can see all of the fields that we had in the spreadsheet are here as well. In this table, we can look at the table options by clicking on these lines. And we can filter fields or center on particular selections. If we've selected a particular row, we can quickly zoom to that row by clicking on Zoom to Selection and clear our selected features and so on. This is how we might change the map style. Say we want to, rather than just show the location only, we can change and actually show a particular attribute. In this case, it doesn't make a ton of sense unless we wanted to compare, say, the dates of these different activities. We could show the dates. But here, maybe it makes more sense to show a heat map of locations. Why is that? Because it's important to note that when geocoding happens, if there are duplicate addresses, you won't see it if you just show location with a dot, because those dots, if there are multiple dots at the same address, will just lay on top of each other. So actually you want to see a heat map to see where there are duplicate addresses. It makes it easier to identify. So here we've selected a heat map showing the same dots, but we can zoom in and get a better sense of whether there are multiple dots on the same address. So here we can click and see, okay, this is just one address. But here we have another one, and it says one of two. And so we can see that this activity is at 7266 Edinger, and it was a social gathering. And if we click this next feature button, we'll see that, there was another person at 7266 at a social gathering. And let's check the person ID. So it's 4329 was the case that had this activity listed. And here it was person or case 4407. So those two cases happen to be at this same social gathering at this same address. Now, we don't know if this address is residential, but we might keep an eye on this location. And if it's a business and we start seeing lots of different contacts and cases that have visited this location, we might target particular public health interventions to make sure that they're doing appropriate cleaning and maintaining social distancing at this location. Okay, so that was an example of how you might use a heat map to look at where there are points clustering. We notice another one down here. So we might click and see, one of three. So let's zoom in. You'll notice that the heat map is dynamic to the scale of the map. So as we zoom in, we might notice that some of the points are actually further apart than initially it appeared. So here we see, okay, it's still one of three, and let's check person ID is different, and they're all, let's see, 24112 Moulton Parkway, works in office. The second activity is a different person, same address, who also works in this office. And the third is yet a different person, same address, and also works in this office. So it appears that now we have three separate cases who work in the same office at this particular location. Now, what's useful about this GIS location-based perspective is now that we have these addresses geocoded, we can look here and see, Laguna Woods Village. That's actually a senior community. And so we might be very concerned that we're seeing multiple people who work in this senior community, multiple cases, positive cases who work in this community are clustered here. So we might want to, again, target interventions specifically to this area. And here we have another place with three activities and plausibly different cases. So let's look at the case numbers again, 4323, 4374. So three different cases, all ate at this same restaurant at this same address. Okay, so again, this is an example of how we might use heat maps to identify potentially locations that need specific interventions, or if we see that shared activity spaces are producing more positive cases. All right, so let's take a look at adding a second bit of information. Now you'll notice there is an add button here, and we could add a file directly, a layer from a file directly to the map. But as I said earlier, we generally don't want to add directly to the map. We want to add from the content area so that we can publish as a hosted feature layer, because that gives us some other options, such as filtering data. If you hover over this little filter here, you'll see this option appears. Now, if we add a layer directly to the map, we won't have that option if we don't have a hosted feature layer. So let's go ahead and we've already opened this map as activity, but let's just save the map as. Always get in the habit of saving the map. It doesn't auto-save as you're working on it. So let's call it contact tracing fake cases. Again, a reminder, please don't share this data. They are real addresses, but fake cases. And so we don't want this somehow getting out and being misinterpreted. And we'll use the COVID-19 tag on all of these associated maps. And you could give it a nice summary. It's good best practice to really document everything that you're uploading. In my summary, I should put fake cases do not use as a reminder to myself, and potentially if you share the data to any others. All right, so we're going to now go back up to this Home tab and click the drop down and select Content, and we're going to add our second file of content. So we've already added the Activity CSV, and we need to add two more. We're going to add the cases and the contacts. Again, we're looking specifically for the CSV files. Will it work if you add it just on accident, say you add the Excel spreadsheet? Possibly, but again, it may be glitchy. And so generally working with the CSVs is best practice. We can title this map cases, since it's the cases CSV. Again, give it the same tag, COVID-19. Make sure publish as a hosted layer is checked. And we're still locating by addresses. All three of these CSV are address files. And again, you'll notice the case address field is going to be used as the address field in the geocoding process. And we have a separate zip code field that can be used in the geocoding process as well. And then we will add item. And it will automatically open up this page after adding the content, and it'll ask you, do you want to review the matched locations? 118 of them were matched. And we'll click yes, just to verify that the cases went to Orange County. And it looks like it did. Again, it will zoom in to the extent of the map, that is to where all of the cases are located. So you can just spot check. If they're all in Orange County, then the geocoding process went well, and they all matched, 118 of them. So we'll click Done Reviewing, and now we see that we have our cases added as a layer. And after we add our third bit of content, so we're now going back to the content area and we're going to add our third layer, then we'll be able to put them all on the same map, that map that we started previously. So notice they're all now being added. So we have the activity CSV that was added, and then it was added as a feature, a hosted feature layer. We created a web map out of that activity feature layer. We added cases as a CSV and also published it as a feature layer. And now we're going to add the final one, going to add item from your computer, and we will add the contacts. Again, looking for that comma separated values CSV file, giving it the title contacts, tag will be COVID-19 again, and we are definitely publishing as a hosted layer, and locating features because they are addresses still. We're going to use addresses. And again, scroll down and find that contact address field and click for address or place field. And the contact zip will be used as the zip field. Hopefully you're getting the hang of this, and we can add the items now. And if this geocoding process goes well, this is the largest file, so we'll see what happens. So 589 locations were matched. Do you want to review? Yes. And it went to Orange County again, so that's great. All 589 points were placed and presumably in the correct location. Again, you would be more thorough in reviewing your geocoding in an actual geocoding scenario. You want to make sure that the points went where you expect them to go. All right, and so here we can see that again, it's just showing the location. So it's created a map for us, but we're not going to save it. We're going to go back into the content area and we're going to open up that prior map that we created that we called Contact Tracing Fake Cases. And we're going to add these other two layers to it now that we have all three files up. So let's open in Map Viewer. Notice that you have other cool options here. You can explore those if you'd like. And once we open up our Contact Tracing Fake Cases, now we can add the two layers that we created from contacts and cases. So we're going to go to Add and then search for layers. That's going to allow us to look in My Content. Now up here, if it doesn't default to My Content, make sure you select My Content, and you should see the things that you've just uploaded, contacts and cases. So we'll add both of those. You can add them by clicking the plus sign, and here as well. And remember, we didn't change the default symbolization on those. So now we've added them and they're shown exactly in the same symbol. If we click on the legend for cases and on the legend for contacts, you can see that they're symbolized in the same way. And then we have a heat map for our activity. And the heat map is just showing us where there are locations with duplicate addresses. So maybe multiple activities were reported either by the same case or by different cases. So we can turn off the activity for a moment and just look at cases and contacts. And let's say we want to change the symbol for one of these. We'll leave cases red since that's fairly intuitive. And maybe let's change the style on contacts. So again, you'll see the little geometric shapes and colors. That's the way that you can change the style of and the type of a map. We still have the same option to use a heat map. Again, because these are geocoded points, we don't know if there are multiple people at the same address that are listed as contacts. Those dots are all showing one on top of the other. So it's not really a great way for us to see where there are multiple cases. So we're still going to show the location. Maybe we're going to show it in a different color so that we can distinguish the cases from the contacts. And you can do that by just clicking on the symbol to change the symbol. And maybe we'll make the contacts blue. This is going to be a huge symbol size. Let's try a slightly smaller. There we go. And so now we can see the contacts are shown in blue. But again, we still don't see where there might be multiple contacts in the same household. So what we want to do is click on this cluster points button. And this is going to allow us to cluster so that we can see where there are points, multiple people in the same household. We're going to use the least amount of clustering. Why? You'll see that, let's say there are 2 points. Let's see, these 2 in Laguna Woods. They're fairly close to each other. The more clustering we do, those points might actually go on top of each other because the radius of clustering gets larger. So here you can see that they're spreading out, but even at the lowest level of clustering, now we have larger dots for areas or addresses rather that have more contacts in those places. And so how do we know? Let's take a look at one of these. We might say, okay, this cluster represents 16 features. Oh, wow, okay. Let's see if they're all at the same address. Click on Zoom to. And now that you've zoomed in, you can see that they are somewhat spread apart, right? And if we click on each of these, we can see, okay, this cluster represents 2 features. This cluster represents 3 features. And so we might browse these 3 features and see, are they all at the same address at 20171 Crown Reef Lane? So we'll click the arrow and yep, this is in the same household and this is also in the same household. Okay. And so we can do that for these different areas. Wow, this cluster represents 4 features. I'm saying wow, but they're fake data, remember? And so we might browse these features again and take a look at what are the characteristics of some of these folks, what were their test results. If we have people that are in the same household with someone who's positive but haven't been tested, we need to identify those folks. And so we can actually filter to do some of those queries, and that will make it easier to identify these targets. Okay, so you'll see the clustering is helpful to see when there are multiple people in the same household, and we do need to zoom in because the further out, again, it's dynamic to the scale of the map, and so the further out we are, the more the points cluster, and so you won't get a great view of whether all these folks are in the same household. It's not 16 people in the same household, but we don't know that until we zoom further in. Nonetheless, this is giving us an interesting picture of where our cases are, primarily in the Irvine, Newport area, and then how spread out our contacts are. I said Irvine, Newport, but then there are some over here as well, right? Lake Forest. And then our contacts are far more spread out throughout the county. And then if we add the activity areas, we can get a sense for where folks are, the cases that we do have activity information for. And if we open up the table, you'll see that wasn't very many, right? We only have 13 total activities. Some of them are the same case ID. So here we have 2 activities for the same person, case 4323. Works in this office, 8 at this particular restaurant. We have 2 for this particular case ID here, and for some of these we only have 1. And for most cases we don't have any activity information. But it's still helpful to get a sense for where there are shared activities if these are frequently reported areas. We can also adjust the transparency. Say we feel that this is obscuring some of the data. We might adjust the transparency on this particular layer so that we just get a hint of these activity spaces, but can more clearly see the cases and contacts on top. We can also change the ordering if we wanted cases to be on top of, or contacts to be on top of cases, or vice versa. We can change the ordering of these layers, and you'll see that they draw in the order that you are telling it to draw. So here are some clusters of both cases and contacts, and here you'll see the cases are on top of the contacts. But if we switch the order of the layers here, they will be in the opposite order. And why are you not letting me do this? Let's see. All right, so now we have the contacts on top of the cases, and you'll see since these are larger points, they obscure some of the cases. So we might want to keep cases on top. Okay, so these are just basic functions in GIS to help you visually explore the data and try to understand how these things are related. We can do one additional step and add some contextual information to our map. We might want to know among these folks here who are in this area of Irvine or Newport, are there contextual risk factors for increasing transmission? Should we target our public health messaging to these particular positive cases in a particular area because we know that if spread happens in that area, it's more damaging? So what we can do is go up to the Add button and search for layers or browse Living Atlas layers. These are slightly different. You can search for layers in just ArcGIS Online. So earlier we searched for layers in My Content, but you can search for layers in either ArcGIS Online broadly or specifically a tool called the Living Atlas. And if you go into the Living Atlas, it's Esri curated content. So it's authoritative, recommended by this Esri company, which creates the ArcGIS Online software and is the industry standard really in GIS. And so the data that you find in Living Atlas are curated, authoritative, and tend to be very up to date. So we might search Living Atlas, or we might just search ArcGIS Online and make sure that we're looking for Esri curated or authoritative content. So here we looked at, let's see, what do we want to try to look at? Vulnerabilities. Excuse me. So vulnerability, COVID-19, and we want to add census tracts because there is a data set that looks at this low geographic level, right? If we look at the city level, it's not as nuanced. And so we want really the lowest level of geography for some of the data that we can find. So here we see census tract COVID-19 vulnerability index. If we click just on this box, it opens up a description and we see who it was created by. It is part of the Living Atlas Esri curated content, so we can be fairly confident that the data quality is great. It was when it was last updated, end of April, and it looks at demographic indicators that have been identified as risk factors for developing severe illness, complications, or death as a result of the virus. And we'll see more specifically what the data sources are and the methodology if we want to. So we can add this layer to the map and then go back to our extent of the map. And notice that it's added to the top of the map, and this is what's called a choropleth map. It's useful for showing rates and ratios, but it's not useful for showing count data. So say these count of cases, we wouldn't want to aggregate those cases to census tracts and show them as a choropleth map, only if they were rates per 10,000 population, for example, would we show as a choropleth map. But this works as a vulnerability index. However, you'll notice that it's covering up our points. So we might move this to the bottom of our map so that our points are more visible. So now we can go further out on our map and look at where are some of the clusters of cases and where are the larger number of contacts and where do they overlap with high vulnerability areas. So if we want to look at the legend for the vulnerability index, we can see that these darker brown areas are more vulnerable. And so just visually, we can look at where there are more vulnerable areas and see are there cases in that area. Here we have all of the cases and all the contacts, and maybe that's not so instructive because many of the contacts have tested negative. So what we can do is filter the data for contacts. So if you hover over again this funnel shape, you'll see the filter on our contact layer, and we can filter to match particular expressions. And since we have a field that tells us the test result for the contact, we can select this field, and then we can ask for the unique values in this field. And there are only two options. They either weren't detected or were positive. And you might have in some spreadsheets perhaps a hasn't been tested field. And so you might be interested to see where there are contacts that haven't been tested, especially if we know that they have certain activity spaces where there are more vulnerable people, or they live in an area with more vulnerable population. So we're going to filter our contacts to only show those that are positive, that have tested positive. Okay, and so we still see this area here with this larger cluster. Now there are 5 features, but they're all in this neighborhood. And if we look at the characteristics of this census tract, we can see that the vulnerability index is high. It's 83. And it's based on the demographics, the underlying health issues, and then health infrastructure. And so we might zoom in and query this so that we can identify who these 3 features are, who these 3 contacts are. And we can see that they're all living in separate addresses. So actually, this represents 2 features. And here we see the contacts that are positive. One is at 8721 Ninth Circle. And this contact here, sometimes it's a little hard to get the contact to show up if you have multiple layers in your pop-up. So here we see 8792 Gallant Drive, and if we browse here, it's 2171 Crown Reef, right? And so we might reach out directly to these contacts and make sure that they are quarantining, especially because they're in an area that is generally vulnerable. Again, we're making some assumptions here. So we may not know that those folks have contact with others in that census tract. It's very useful to know where their specific activity spaces are, and that's been some of the logic behind actually having digital contact tracing to collect information on people's locations rather than assuming where they're likely to have activities just based on where they live. We know that they might work somewhere else and maybe eat out around that work area rather than where they live. Nevertheless, we go with the best information that we can find and try to target our efforts based on that. Okay, so we have covered a lot of ground here. We've looked at how to add data from the Living Atlas or search for layers from ArcGIS Online. And we added one layer that's COVID vulnerability for census tracts, and it's visualized as a choropleth map by default. And we can change that if we wanted to, but you'll notice it's counts and amounts using color as the default, and it worked well for what we wanted to do. And we used points to visualize our contacts and our cases. And we used clustering on our contacts so that we could see where there are places with more contacts. And we used a single symbol for our cases. And we also filtered our contacts to only show positive contacts that have tested positive. And we've looked at a heat map of activity areas for the cases that reported activities. And so we have this all layered all onto one. And actually you'll see that the activities are kind of obscured by the vulnerability index. So if we were actually analyzing this, it would be helpful to turn on and off different layers to really better look at some of these areas, or even again use that transparency, set the transparency on perhaps the vulnerability layer, so that you can still see the vulnerability, but you can also detect perhaps the activity spaces underneath it. So you can play with some of these settings to best visualize the data. You'll notice that the vulnerability data are not complete. It's based on the 500 cities data, if I recall. And so it doesn't have complete information for the whole county. And that's why we see some of these gaps in some of these areas, and that's fine. All right, and then the last thing that we are going to do is what's called a join. We want, because we know that these activities, these 13 activities, are actually tied to specific cases, we want to join the table of activities to the table of cases, which contains the information on the person's race and ethnicity and their residential address in addition to their test status and so on. So we want their activities together. So we're going to use a process called a join. So if you go to the cases layer, you can click on perform analysis. And we are going to summarize the data and click on join features. And we're going to join the activity layer to the cases layer. So we want the activities to be the layer that's going to join into the target layer, which is the cases. So we really just want to add activities to those cases that have activities. And that's going to happen based on the shared field. And the field that identifies those cases is the person ID field. So in both tables, the target field is person ID and the join field is person ID. They happen to be called the same thing in both of those tables. So this is asking in the target table for cases, what is the join field called? And in the layer, the join layer, what is the field called? So they happen to be both person ID. And we're going to do a one-to-many join because there are many activities for each case. Plausibly, and some cases don't have activities at all. And we're going to keep all the target features because we want to keep all the cases even if they don't have activities associated with them. So make sure to check keep all target features. And we can call this join activity to cases as the resulting layer name. So what's this going to do? It's going to create a brand new layer with all of the cases and the activities joined to those cases that have activities. So we'll want to call it join activity to cases. You can save the result in your folder. We're going to uncheck use current extent because if you happen to be zoomed in on a very large scale, a very small area of the map, it would only do the join for the cases and activities that fall within that extent of the map. But we want it for all of the cases and activities. And we could create the results as a hosted feature layer if we wanted to be able to filter later on, for example, but we're going to leave that unchecked for now since you can see that there is some credit system associated with using this program. And so it's going to use less credits if we don't use a hosted feature layer. So let's click on Run Analysis. Don't panic if you accidentally clicked while you had Create Hosted Feature Layer checked, that's totally fine. And you'll see that it takes a little while depending on the size of the join. This is not too large. There are only 13 activities, so the join won't take very long, but it may be a few seconds depending on the speed of the internet and your computer and so on. Okay, and then you can see that this new layer has now been added that contains your joined activities to your cases. So notice that now instead of 100 and I think it was 18 cases or features in your case table, you now have 120. Why is that? Because certain cases had multiple activities. So now you'll notice that instead of one line for each case, we've added the activity data along with it. So now we have some activity data, and if you scroll down, you'll see most cases have no activity data, but there are a handful, right, those 13 activities that have been added here as rows. So now we have 2 rows for this case ID, and it duplicates the same case information, but adds on then that activity information for this person. And so this might make it easier to query, if we wanted to filter cases by those that have activities, we might take a look at some of their occupations. Maybe we want to filter to just occupations that are high risk for exposure, for example. So maybe we see that there are, let's see, case occupation, maybe teachers. They're in contact with a lot of students, and so we might be particularly concerned about the cases who are teachers. So now we see only those 20 cases have been filtered out, and we're going to uncheck the contacts and all these other layers so that we just see what new information we've added. So here we have the 20 people that are cases and that are teachers. And we might see that some of them also have activities. And so we'll look and decide whether they have some high-risk activities and or high-risk contacts. We could do the same type of join of the cases to the contacts because they share that information, right? Each contact is linked to a particular case, but we won't do that for purposes here. And we might look at what are some of the activities. Did they share activities with other contacts who tested positive to identify these potentially problem locations? And again, maybe overlay that with vulnerability indices based on where they live. Maybe we're concerned that they have disproportionate exposure, and so we want to make sure that if they live in an area that's vulnerable for transmission, that they are contacted and make sure that they are quarantining and so on. Okay, so this has been a quick introduction to some of the capabilities here of ArcGIS Online and how you might use some contextual information to enhance contact tracing. So I hope this has been helpful for you, and please feel free to just play with the program. It can be a little bit daunting at first, but remember, if you mess anything up, you can easily remove by clicking on the 3 dots, just remove the layer entirely. And you can just remove the layer from the map and go back in and add it again by searching for your layers. And I'm going to save the map because, as I said, it doesn't auto-save, so make sure you save once you are done and you are happy with your final product. And I will be happy to answer any questions or help troubleshoot problems during office hours. So I hope to be able to meet some of you at that point. Thank you so much, and happy mapping to you all.